I'm Dr. Lisa Go, one of the clinicians at Vancouver Island Psychological Services here in Victoria, BC. I'm here to share some tips about managing anxiety during the COVID-19 outbreak. To begin, please remember that it is okay to feel anxious, and in fact, it's normal to feel anxious right now. Anxiety is a natural human response when we feel threatened, and anxiety is actually adaptive in that it helps us to prepare to deal with threat and to protect ourselves. If we had no anxiety, we would actually be worse off because we would be less likely to take appropriate precautions such as hand washing and social distancing that are helping to keep us safe. At the same time, an excessive amount of anxiety can lead us to engage in behaviors that may not actually be helpful, such as spending excessive amounts of time seeking out information online and feeling helpless to do anything about our situation. High levels of anxiety may be detrimental to our well-being in the long run. Therefore, here are some tips for keeping your anxiety manageable as we all face this challenging time. Tip number 1, limit your exposure to the news and social media and choose reliable sources when you do need to seek out information. I cannot stress this enough. This has become one of the most important strategies for mitigating anxiety in the midst of the COVID-19 outbreak. We are being inundated by updates 24/7 from media sources, corporations flooding our inboxes, and from our friends and family posting to their social media accounts. Let me be clear that being plugged in and receiving every update as soon as it happens is unsustainable and likely going to contribute to heightened anxiety. My recommendation is to set aside 1 or 2 times each day to update yourself on news and social media. For example, you can choose to look at the news in your accounts for no more than 20 minutes at 10 a.m. each day. Then unplug and resist the temptation to check again until the following day. Give yourself permission to not know every single thing as soon as it happens and to put boundaries on how much exposure you're getting to this topic. When you do need to look for information about COVID-19, look to reliable sources such as the World Health Organization, the BC Centre for Disease Control, and the Public Health Agency of Canada. Remember that friends and family may not always be reliable sources of information. If you find that there are certain family members or friends who talk constantly about the virus and their worries about the virus, it's also okay to let them know that you need a break and to request that they refrain from talking about this subject. Tip number 2. Focus on the things that are within your control in the present moment rather than the unknowns and the things that are out of your hands. When you're feeling anxious, sit down and take stock, maybe even write down a list of the positive actions that you've done to keep yourself and your loved ones safe. Maybe you watched a video from the CDC or another public health agency about proper hand hygiene and washing your hands regularly. Maybe you've been really working on avoiding touching your face and public surfaces. Likely you are complying with the recommendations to stay home as much as possible. You may also have had a role in teaching your children, parents, friends, or other loved ones what they can be doing to keep themselves safe. Recognize that all of these actions are concrete things you are doing or you can start doing to reduce the risk that you or someone you love will get sick. Give yourself credit for what you're doing and keep your focus on what is in your control. Tip number 3, practice decatastrophizing your thinking. In psychology, we call it catastrophizing when we go to the absolute worst case extreme scenario. When we're worrying about what might happen in the future, we tend to overestimate how bad it will be and how likely it is that something bad will happen. We also tend to underestimate our own capacity to deal with whatever we're afraid of happening. That means we tend to think something terrible will definitely happen, and when it does, I won't be able to cope. To put the brakes on this kind of thinking, it's important to keep in mind, what is the actual likelihood that what you are afraid of happening will happen? With respect to COVID-19, you can keep perspective by seeking out information from accurate and reliable sources to assess your own personal level of risk. For example, find out how many cases have actually been confirmed in your area. How many people have recovered worldwide? How high is your personal risk given your demographics and the precautions you've been taking? Remember, just because something may happen doesn't mean it will happen. If you find your mind does keep going to the worst case scenario, it may be helpful to sit down and write out a specific plan for how you would cope if something you were afraid of happening actually did happen. For example, if you did get sick, who would you call for support? What resources are available to you, and how could you take care of yourself? You will likely find that there are more things in your control than you previously thought. It may also help to think of an example of a time in the past when you were faced with a difficult situation. How did you manage to get through that? What were the active steps that you took to cope? Remember, you have overcome challenges in the past, and you do have the capacity to cope now. Tip number 4. Now is a great time to begin or restart or continue to practice mindfulness and relaxation. Mindfulness and relaxation exercises can be extremely effective for calming our minds and our bodies and for bringing our attention to the present moment in the here and now rather than the unknowns in the future. These exercises allow us to tune into a state of calm and to redirect our focus from worries or stresses that have been on our minds. Practicing daily for as little as 15 minutes is the best way to derive benefits from these techniques. Practicing mindfulness and relaxation is like training a muscle. With regular practice, you'll strengthen these skills and find it easier to tune into a state of calm and relaxation. Don't be discouraged if you find it difficult at first. Like any new skill, you'll become more familiar with it over time. To help you with your practice, we've included some links in the description box to audio recordings from Anxiety Canada. These can guide you through the exercises so that you don't have to worry about reading a script or remembering what to do next. If you're continuing to feel overwhelmed and you would benefit from additional support, there is 24-hour support available at the Vancouver Island Crisis Line. Their number is 1-888-494-3888. Additionally, many mental health clinicians, including our clinicians at Vancouver Island Psychological Services, are offering their services via telehealth so that their clients can continue to receive professional support without putting themselves or others at risk. If you would like more information, please inquire with our administrative staff. You can call them at 250-727-7060. You can also email us at reception@vipsychology.ca. On behalf of all of us at Vancouver Island Psychological Services, we wish you good health, and we look forward to a time when we can see each other once again.